All right, before we dive into this crazy story, do me a favor, subscribe and tell us where you're watching from. The emergency room was already full before midnight. Winter had pushed everything past capacity. Cold air had settled into the city days ago, bringing with it a steady flow of respiratory cases, injuries from slick streets, and patients who had waited too long before coming in. The waiting area was lined with bodies, some upright, some slumped, all tired. Inside, the pace never stopped. Monitors pulsed in uneven rhythms. Stretchers moved in and out of narrow spaces. Voices overlapped, short instructions, clipped responses, names called and repeated. Controlled pressure. Held together by routine. Naomi moved through it without drawing attention. Her steps were quiet, measured. She carried a tray of supplies balanced in one hand, adjusting its weight slightly as she turned into a narrow corridor between beds. Her scrubs were standard issue, sleeves loose at the wrists. Nothing about her suggested urgency. Nothing about her suggested importance. Bed 6. She didn't check the chart first. The patient's breathing pattern had already told her what she needed. She set the tray down, adjusted the oxygen line without being asked, then repositioned the mask just enough to improve the seal. The monitor responded within seconds, numbers stabilizing, not dramatically, but enough to hold. The nurse assigned to the bed didn't notice. She was already moving to the next task. Naomi stepped back. No interruption. No announcement. Just correction. At the central station, Dr. Mercer stood reviewing a chart, his voice carrying over the surrounding noise. "We don't have time for hesitation," he said. "If you're not sure, you ask. You don't guess." An intern nodded quickly, holding a syringe with uncertain hands. Naomi passed behind them. She glanced once at the tray the intern was preparing. Dosage slightly off. Not dangerous yet. But it would be. She didn't stop. Didn't speak. Her hand moved, brief, precise, adjusting the vial, correcting the measurement without breaking the flow of conversation. The intern continued speaking, unaware. Mercer didn't look up. Naomi kept walking. Further down the room, a patient coughed sharply, pulling at the blanket tangled around his legs. Naomi changed direction before the call light activated. She adjusted the blanket. Checked the foreline. Noted the slight swelling near the insertion point. She replaced it, clean, controlled, efficient. The patient relaxed without fully waking. Naomi stepped away. The room closed behind her. She moved along the edge of activity, not in the center, never in the focus. Staff passed her without acknowledgement. Conversations flowed around her without pause. She was part of the system, but not seen by it. "Naomi," Mercer said suddenly. She stopped. Turned slightly. "Yes, doctor." He didn't look at her immediately. He finished marking something on the chart first. "Room 3 needs prep. Keep it basic. We're short on time." "It's already done," she said. He glanced up then, brief, evaluating. Then dismissed it. "Fine. Stay on support." Not a compliment. Not a correction. Just placement. She nodded once. And moved. Near the medication station, 2 nurses worked quickly through a backlog of orders. One of them reached for a pre-filled syringe, her attention divided between the chart and the patient behind her. Naomi slowed. Just enough. The label was correct. The preparation was not. She reached past, quietly, without breaking the nurse's movement, and switched the syringe with one properly calibrated from the tray beside it. No interruption. No explanation. The nurse picked it up seconds later and continued without pause. Naomi stepped away. Further down the hall, a stretcher rolled past too quickly, wheels catching slightly on the edge of a tile. Naomi shifted her path half a step before contact could happen. The orderly didn't notice. The patient didn't wake. The moment passed. Naomi's eyes moved, not obviously, not in a way that drew attention, but they tracked everything. Entry points. Exit routes. Which doors were left ajar? Which staff moved with urgency and which moved with habit? Sound patterns. Footsteps. Voices rising and falling. She registered the difference between noise and change. Near the far wall, a security door opened briefly, then closed. 2 new staff entered. Unfamiliar. Temporary. She noted their faces once, then moved on. At the nurse's station, Mercer raised his voice again. "We don't repeat mistakes tonight," he said. "We don't have the margin." No one responded. They didn't need to. The pressure was already understood. Naomi passed behind him, placing a fresh box of gloves into an empty dispenser before it was noticed. She aligned the edges without looking, then continued toward the supply cart. Her movements remained steady, unhurried, as if the pace around her did not apply. At the far end of the ER, a monitor alarm sounded, sharp, irregular. Heads turned. Movement shifted. A nurse called out, "We've got instability in intake." Mercer straightened immediately, chart already set aside. "Bring them in," he said. Now. The doors opened. Cold air followed. A stretcher pushed through at speed, patient pale, breathing uneven, condition unclear. The room adjusted. Not chaos, but close. Naomi didn't move toward the center. Not yet. She watched. Measured. The pattern of the room changing again. Pressure increasing. The system stretching. And somewhere beneath it, something beginning to break. The stretcher came in fast. Too fast for a controlled intake. Clear space, Dr. Mercer said, already moving. The patient was young. Early 20s, maybe. Skin pale under the overhead lights, breath shallow, uneven. Blood marked the side of her jacket, not heavy, but enough to suggest internal damage. Maya, one of the paramedics, said, "Single vehicle crash. No loss of consciousness reported, but vitals unstable en route." They transferred her in one clean motion. "Vitals?" Mercer asked. "Fluctuating." Pressure dropped twice. Mercer nodded once. "Trauma Bay 2. Let's move." The team shifted around him, aligning quickly, forming a controlled perimeter of motion. Equipment followed. Orders shortened. Focus narrowed. Naomi stepped in without being called. Not to lead. To support. "Monitor," Mercer said, not looking at her. She was already there. Leads placed. Pulse tracked. Oxygen adjusted, not aggressively, just enough to stabilize without forcing resistance. Maya's breathing steadied slightly. Not safe, but holding. Naomi's hands remained steady as she secured the final line. Her eyes moved across the patient, skin tone, response delay, muscle tension. No external panic, but something beneath it. Unresolved. Mercer moved to the visible injury first, checking for fractures, external trauma, anything immediate. "Prep imaging," he said. A nurse moved to comply. "Keep her stable," he added, stepping away to the next case already calling for attention. The room didn't stop. It expanded. Another patient called out from across the ER. A child crying somewhere near the waiting area. A monitor alarmed briefly, then reset. Pressure layered on pressure. Naomi remained at Maya's side. Assigned. Unremarkable. Her focus stayed on the patient, but her awareness extended beyond the bed. The corridor behind her carried movement. Normal at first. Staff passing. Equipment rolling. Then a pause. Not complete, but misplaced. She didn't turn her head. Just listened. Footsteps. slower than the others. Not hesitant. Measured. They stopped near the intake desk, then moved again. The rhythm didn't match. Naomi adjusted the monitor lead by a fraction, eyes still on Maya's vitals. Stable. For now. A nurse passed behind her, speaking quickly into a handheld radio. Security's checking a report near the west entrance, she said. Of what? Someone asked. Not sure. Probably nothing. The answer moved through the room without weight. Minor irregularity. Routine. Not enough to shift focus. Mercer didn't react. He was already handling a different case, visible trauma, immediate priority. Naomi noted it. Not the report. The dismissal. She shifted her stance slightly, angling her position just enough to catch the reflection in a glass cabinet across the room. The corridor behind her came into view. 2 figures passed. Staff uniforms. Expected. Then a third. Different. Not in uniform. No badge visible. Walking with purpose, but not urgency. Not lost. Not searching. Moving through. Naomi returned her gaze to Maya. Her hands adjusted the four-flow, minor correction, maintaining balance. Her mind held the image. Logged. Compared. The corridor pattern continued. Staff moved in clusters. This one didn't. Spacing wrong. Pace controlled. She tracked the timing between steps. Consistent. Too consistent. Maya, can you hear me? She said softly. The patient didn't respond. But her breathing shifted slightly, reactive, not conscious. Naomi watched the response, then listened again. The footsteps had stopped, just outside the ER boundary. Waiting, or observing. She considered it. Options. Escalate, call it out, trigger attention, but there was no confirmation. No direct threat. Not yet. If she was wrong, it would disrupt the room. Divide focus. Cost time. Time they didn't have. Mercer's voice cut across the space. Naomi, keep her stable. We'll reassess in 5. Understood, she said. Her tone remained even. No urgency. No signal. She stayed. Watched. Waited. Maya's vitals shifted again, slight drop, then recovery. Naomi adjusted positioning, lifting the shoulder just enough to ease the strain. The monitor responded. Stable again, but fragile. Behind her, the corridor resumed movement. The figure reappeared. Closer now. Walking directly toward the ER entrance. Still no hesitation. Still no visible purpose. Naomi's eyes flicked once to the reflection, then back. Her breathing remained steady. Her hands continued their work. Inside, nothing had changed. But something was approaching. The doors to the ER stood open, constant movement in and out. Uncontrolled access under pressure. Necessary. And vulnerable. Naomi calculated distance. Time to entry. Line of sight. Number of staff between the door and the patient. Too many variables. Too little certainty. She chose to wait. 1 more second. 1 more confirmation. The figure reached the threshold. Paused. Just long enough to look in. Not scanning broadly. Selecting. Naomi saw it. Not with her eyes. With the pattern. This was not random movement. Not misplaced presence. This was intent. Her hand tightened briefly on the side rail. Then released. Maya's breathing remained steady. For now. Naomi shifted her weight, subtle, controlled, placing herself between the patient and the open line of the doorway. Not obvious. but deliberate. The figure stepped inside. No announcement. No hesitation. Just entry. And the pressure in the room changed. Not visible. Not yet. But real. And irreversible. The sound did not echo. It cut. A single crack, sharp, contained, controlled. Not loud enough to create chaos. Just enough to stop movement. The ER froze. Not panic. Not yet. A pause. Every motion held in place as the sound settled into understanding. Gunfire. Naomi did not turn immediately. She didn't need to. Her body had already registered the direction. Entry point, front corridor. Angle, slightly off-center. Distance, close. Her eyes remained on Maya. The patient's breathing had spiked, reactive, shallow, unstable. Naomi adjusted the oxygen flow before anything else. Not faster. More precise. Stabilizing the reaction before it became a collapse. Behind her, a tray dropped. Metal against tile. Too loud now. Too uncontrolled. Everyone stay where you are, a voice said. Calm. Measured. Carrying without force. Naomi turned then. The man stood just inside the ER entrance. Weapon held low, not aimed, not waving, just present. Deliberate. He had chosen the shot. And the silence after it. A warning. Not an accident. Not panic. Intent. Naomi saw it immediately. This was not chaos. This was control. Mercer stepped forward. Not close, but enough to be seen. This is a hospital, he said. You need to put that down. His voice was steady, professional, trying to reframe the space. The man didn't react, didn't shift his stance, didn't raise the weapon, just watched. Measuring. The room held. No one moved. No one spoke. Naomi stepped sideways, small movement, barely noticeable, placing herself between Maya and the open line from the doorway. Not blocking. Changing angle. Reducing exposure. Her hand adjusted the bed slightly, just enough to align with a structural column behind it. Partial cover. Not obvious, but effective. The patient in the adjacent bay shifted, confused, beginning to sit up. Naomi reached back without looking. A hand on the shoulder. Firm. Stay down, she said quietly. No explanation. Just instruction. The patient froze. Listened. The gunman took one step forward. Slow. Controlled. His eyes moved across the room, not scanning wildly, but selecting points. Entrances. Exits. People. He was not searching. He was confirming. Naomi tracked it. Every shift. Every pause. His attention didn't linger on the center. It moved along the edges. Looking for resistance. Looking for disruption. Security appeared at the far end of the corridor. Late. Unprepared. Sir, you need to, the guard started. The gunman didn't turn. Didn't aim. He fired again. A second controlled shot. Not at a person. At the wall beside the guard. Close enough. Precise enough. The guard stopped. Step back. Control lost before it had begun. The gunman lowered the weapon again. Still calm. Still measured. Close the doors, he said. No raised voice. No urgency. Just instruction. No one moved. Because no one was assigned to move. Naomi saw the gap. The hesitation. She stepped back half a pace toward the nearest sliding door control. Her hand reached it without drawing attention. She pressed it. The doors behind the gunman began to close, slow, controlled. Not sealing the room, containing it. The gunman glanced back once. Saw it. Allowed it. Because it served his purpose. The space narrowed. Defined. Mercer tried again. You don't want to do this here, he said. There are patients, I know, the man replied. His voice remained even. Not emotional. Not reactive. I need everyone to stay exactly where they are. The word settled into the room. Not a threat. A condition. Naomi's eyes moved again. The corridor behind him. Now partially closed. Limited access. Security outside. Ineffective. Inside, staff. Patience. No clear authority. She adjusted the second bed, subtle shift, aligning it behind the first. Layering cover. Reducing lines. Her movements remained slow. Unnoticed. The gunman's gaze passed over her. Did not stop. She remained what she had been before. Unremarkable. Mercer stepped slightly to the side, positioning himself between the gunman and the central cluster of patients. Not trained, but trying. This isn't necessary, he said. The man's eyes returned to him. For a moment, assessing, then moved on. Not a threat. Not a priority. Naomi understood. This was not about dominance. Not about noise. It was about control of space. Control of movement. And something else still not visible. The patients began to shift again, small movements, uncertainty building. Naomi moved quickly now, but still quiet. She lowered one bed, raised another, adjusted angles, placed bodies behind objects that would slow a line of sight. No instructions, no explanations, just positioning. The room changed around her. Safer. Not safe, but better. The gunman took another step, now fully inside the ER. The corridor behind him under his control. The doors nearly closed. No easy exit. No outside intervention. He turned slightly, facing the room, owning it. The weapon remained low, but ready. Naomi watched. Not his hands. His timing. His breathing. His focus. Waiting for the moment he would act again. Because this was only the beginning. The silence did not break. It settled. The kind that follows a sound no one is prepared to process. The staff remained where they were, frozen not by panic, but by uncertainty. No one moved because no one understood what movement was safe. Dr. Mercer stepped forward again, still trying to control the space with words. This doesn't have to escalate, he said. If you're looking for something, we can. The gunman did not respond. He shifted slightly, not toward Mercer. Away. His attention moved along the room again, edges, corners, lines of sight. Not random. Not reactive. Selecting. Naomi saw it clearly now. This wasn't a break. It was a scan. Mercer misread it. He interpreted the silence as hesitation, as instability. You don't want anyone hurt, Mercer continued. There are protocols. The man's gaze returned to him briefly. Flat. Then moved on. Mercer wasn't the focus. He was noise. Naomi stayed where she was near Maya's bed, hands resting lightly on the rail. Her posture remained neutral, unthreatening. But her eyes tracked everything. The gunman's movement had rhythm. 3 steps. Pause. 2 seconds. Shift. Repeat. He was mapping, not reacting. Her mind moved ahead. If this was random, he would be unpredictable. Erratic. This wasn't. This was controlled, which meant there was an objective. She adjusted Maya's bed again, lowering it by a fraction, angling it further behind the structural column, reducing exposure. The movement was small, invisible in the larger stillness. The patient in the next bay began to whisper, fear creeping in, unable to hold. Is this what's happening? Naomi reached across without looking. A hand pressed lightly to the side of the bed. Stillness. The whisper stopped. Across the room, a nurse shifted her weight just enough to draw attention. The gunman's head turned. Not fast, but exact. The nurse froze. Too late. The gunman raised the weapon slightly. Not fully. Not aimed. Just enough. Don't move, he said. His voice didn't change. The nurse nodded quickly. Hands raised halfway, unsure where to place them. Mercer stepped in again. Please, she's just... The gunman fired. One shot. Clean. Controlled. Not lethal. The bullet struck the edge of the bed frame beside the nurse, ricocheting low. Metal against metal. The nurse gasped, stumbling back, her leg catching the edge of the cart. She went down hard, the impact sharp, breath knocked from her. Injury. Not direct, but real. Enough to change the room. The silence broke. Not into chaos. Into understanding. This was not warning. This was enforcement. Naomi moved immediately. Not toward the gunman. Toward the nurse. She dropped to one knee, checking the leg, no direct wound from the shot, but impact trauma from the fall. Painful. Not critical. Stay still, Naomi said quietly. Her hands moved, checking alignment, stabilizing the leg, pulling a nearby blanket into position to reduce movement. No wasted motion. No hesitation. Behind her, Mercer stopped speaking. Finally. The reality had caught up. This was not something he could manage with authority. The gunman lowered the weapon again. Not reacting to the injury. Not escalating. Just continuing. Naomi's eyes lifted briefly. Not to his face. To his stance. Unchanged. The shot had not been emotional. It had been instructional. Her mind confirmed it. This was controlled. Deliberate. He wasn't here to cause chaos. He was here to shape it. She finished stabilizing the nurse, then shifted her position slightly, placing the fallen body further behind the bed, reducing visibility from the open angle. Another small change. Another layer. Across the room, patients had gone completely still now. No whispers. No movement. Understanding had spread. This was not random violence. This was precision. Mercer looked around, taking in the room, the injury, the gunman. His expression shifted. Not confident anymore. Uncertain. What do you want? He asked. The question came too late. The gunman didn't answer. He stepped forward again. Slow. Measured. His eyes moved past Mercer. Past the central cluster. Toward the deeper part of the ER. Toward the patients not immediately visible. Naomi followed the line. Not with her eyes. With the pattern. He was narrowing. Closing distance. Not to dominate the room. To reach something inside it. Maya. The position. The angle. The path aligned. Naomi's hand tightened slightly on the bed rail. Then released. She understood now. This was not a presence. Not a disruption. This was a controlled entry. A targeted operation. And the room was already inside it. The room did not return to normal. It adjusted. After the shot, after the fall, after the first injury, everything slowed into something tighter. Controlled not by safety, but by fear of making the wrong movement. Naomi stayed low beside the injured nurse. Her hands worked with quiet precision, checking alignment again, confirming no fracture displacement, stabilizing the joint with what was available. A folded blanket became support. A strap secured it in place. "Can you feel this?" she asked softly. The nurse nodded, breath uneven but present. "Stay still," Naomi said. "You're not in danger if you don't move." The words were simple. Not reassurance. Instruction. The nurse followed. Naomi's attention shifted, quick, controlled, back to the room. The gunman had not reacted to the injury beyond creating it. He had already moved on. 2 steps forward. Pause. Scanning again. His rhythm had not changed. That mattered. Near the far side of the room, a man in hospital security uniform stepped into view, different from the first guard. Older. More composed. His name tag read Ortega. He stopped just inside the boundary, taking in the scene without speaking. His eyes moved across the room once, then settled, briefly, on Naomi. Not because she drew attention, because of what had changed around her. The positioning, the placement of patients, the absence of chaos near her section. He didn't speak, but he watched. Naomi stood. Slowly. No sudden movement. Her posture remained neutral as she moved back toward Maya's bed. Her hands returned to the line, checking flow, pressure, the balance she had maintained since intake. Maya's breathing had shifted again, subtle but unstable under stress. Naomi adjusted the angle, lifting the shoulder slightly, correcting the line of oxygen. The monitor responded. Stabilized. Again. Mercer noticed this time. Not the action. The result. His eyes flicked to the monitor, then to Naomi. A moment of recalibration. Then he looked away, not ready to question it, but no longer dismissing it entirely. Across the room, the gunman moved again. Naomi tracked it without turning. 3 steps. Pause. His attention narrowed. Closer now. Closer to Maya's position. Her mind moved ahead. Distance to bed. Time between his pauses. Line of sight between him and the patient. If he continued, he would reach them within seconds. She shifted her stance. Subtle. Aligning her body between the gunman's path and Maya's position. Not obvious, but deliberate. Ortega saw it. His gaze sharpened slightly. He adjusted his own position in response, stepping just enough to create a secondary angle, placing himself where he could intervene if needed. No communication. Just alignment. Naomi's movements began to change. Still quiet, but timed. She waited until the gunman turned his head, briefly scanning another part of the room. Then she moved. A quick adjustment of the bed, half an inch. A shift of the forestand closer to the frame. A repositioning that reduced the open line. Before his gaze returned. Invisible. Unless someone was watching for it. Ortega was. Mercer was starting to. The gunman took another step. Closer. His attention now fully within Naomi's section. Maya shifted on the bed, small movement, involuntary. The kind that draws attention. Naomi reacted instantly. Her hand pressed lightly to the patient's shoulder. "Stay still," she said. Quiet. Controlled. The movement stopped. But it had been enough. The gunman's head turned. Directly. Toward them. The line had been found. Naomi didn't move. Didn't look up. Her posture remained unchanged, focused on the patient, as if nothing else existed. But her position held. blocking, reducing. Ortega took one step forward. Not enough to escalate. Enough to be ready. Mercer saw it now. The alignment. The pattern. The way the space around Naomi had been shaped. His eyes narrowed slightly. Understanding beginning. Too late. The gunman shifted direction. Not scanning now. Moving. Direct. Toward Maya. Naomi calculated the distance. 3 steps. 2 seconds. No time to reposition further. Only to decide. Remain hidden or act. Her hand moved, adjusting the line one final time, ensuring stability. Then she stepped forward. Into the path. Not aggressively. Not confrontational. Just enough to be there. To change the approach. The gunman slowed. Just for a fraction. His eyes settled on her. Really looking this time. Not passing over. Not dismissing. Seeing. The stillness. The control. The absence of fear. Recognition. Naomi held the position. No words. No challenge. Just presence. Ortega shifted again, closer now, ready to move. Mercer watched. No longer dismissing. The room held. Tension building into something sharper. The gunman's gaze remained on Naomi. Longer than anything else in the room. Measuring. Reassessing. The pattern had changed. Because of her. And he knew it. For the first time since entering, his attention had a target. Not the room. Not the chaos. Her. Naomi didn't move. Didn't break. But inside, she understood. She was no longer invisible. And whatever came next would come through her. The distance between them held. Not far. Not close. Enough to act. Enough to hesitate. The gunman stopped 2 steps short of Naomi. His weapon remained lowered, not relaxed, not idle, just not raised. Control. Everything about him stayed controlled. His eyes did not leave her. Not scanning now. Focused. The rest of the room faded from his attention. Naomi didn't move. Her posture remained steady, one hand still near Maya's bed, the other relaxed at her side. No tension in her shoulders. No shift in her stance. She did not challenge him. She did not step back. She stayed. The silence stretched. Then he spoke. "You moved them," he said. Not a question. A statement. Naomi's gaze stayed level, not fully meeting his, not avoiding. "I adjusted the room," she replied. Her voice was calm. Even. Nothing extra. The gunman studied her. "You changed the angles," he said. Naomi didn't respond immediately. Her eyes flicked once, brief, controlled, toward the monitor beside Maya. The numbers held steady. Then back. They needed to be stable, she said. Still not answering him. Still not engaging the real question. The gunman shifted his weight slightly. Not aggressive. Testing. "Most people freeze," he said. Naomi's expression didn't change. "Most people aren't responsible for patience," she replied. Simple. Direct. Incomplete. He watched her longer, looking past the words, at the structure behind them, the discipline, the restraint. Behind her, Ortega moved half a step, quiet, controlled. His hand lifted slightly, signaling one of the staff to shift position. Naomi saw it without turning. Her fingers moved, subtle, almost invisible, adjusting the fall line, but the motion carried a second meaning. Wait. Not yet. The staff member froze mid-step. The signal held. The gunman noticed the stillness. His eyes narrowed slightly. Not suspicion. Recognition. "You're controlling the room," he said. Naomi didn't deny it. Didn't confirm it. "I'm keeping them alive," she said. Her tone remained unchanged. No edge. No emotion. Just fact. The gunman's gaze dropped briefly to her hands, to the way they moved. No wasted motion. No hesitation. Then to her wrists. The sleeve of her scrub top had shifted slightly during movement. Just enough. Faint lines beneath the skin. Old. Linear. Not accidental. His eyes stayed there for a moment, then lifted. Back to her face. "You've done this before," he said. Again, not a question. Naomi adjusted the edge of the blanket covering Maya, small correction, unnecessary, but controlled. Her sleeve shifted back into place. The marks disappeared. She did not answer. Mercer was watching now. Fully. No longer focused on the broader situation. On her. The precision. The timing. The way the room had changed around her without instruction. He stepped slightly closer. Not interrupting. Observing. "You need to step back," Mercer said, his voice lower now, not authority, but uncertainty. Naomi didn't look at him. "Not yet," she said. The words landed differently. Not defiance. Assessment. The gunman heard it. His gaze flicked briefly to Mercer, then back to her. "You're not just staff," he said. Naomi's eyes remained steady. "I'm assigned to this patient," she replied. Still within the role. Still contained. But no longer invisible. The gunman took one step closer. The space tightened. Ortega shifted again, closer to the side, preparing for movement, but waiting. Naomi didn't move. Didn't retreat. Her breathing remained even. Her posture unchanged. The gunman studied her in silence. Long enough for the room to feel it. The difference? He was no longer controlling the space alone. He was sharing it. With someone who understood it. "You're not afraid," he said. Naomi's gaze didn't shift. "Fear doesn't change the outcome," she said. Not dismissing. Not denying. Just stating. His expression changed slightly. Not anger. Not frustration. Adjustment. He stepped back. Just one pace. Creating space again. But the dynamic had shifted. He was no longer scanning the room for control. He was recalculating. Around her. Mercer saw it. The shift. The recognition. And something in his own posture changed. Not authority. Acceptance. He stepped back as well. Giving space. Following a structure he hadn't set. The gunman's eyes moved once more across the room. But differently now. Not mapping. Repositioning. Strategy changing. Naomi tracked it. Every movement. Every pause. Her mind moved ahead. If he changed approach, he would stop controlling broadly. Start targeting specifically. Her. Or the patient. The room held again. But tighter. More focused. The balance had shifted. Not broken. But no longer his alone. And he knew it. Because for the first time since entering, he wasn't the only one thinking ahead. The room no longer belonged to one person. It had divided. Not visibly, but in structure. The gunman still held the weapon. Still controlled the entry point. Still dictated the outer boundary. But inside, movement had changed. Naomi felt it. Not as a shift in noise. As a shift in alignment. She stepped back toward Maya's bed. Slow. Measured. returning to position without breaking eye contact for too long. Her hands resumed their work, checking before, adjusting flow, confirming oxygen stability. The patient's breathing remained fragile, responsive, but exposed. Naomi's attention moved outward again, not scanning broadly, selecting points. The patients closest to the open line, the staff positioned without cover, the equipment that could either block or obstruct. She began to move, not directly, in fragments. A step to the side, a hand to a bed rail, lowering it slightly. A quiet reposition of a cart, turning it just enough to widen the barrier between two patients. No instructions, no announcement, just change. Ortega watched. He didn't ask. He followed. One step to the left, closing a gap she had opened. His hand lifted briefly, signaling a staff member to stay low. The staff member complied without question. The pattern continued. Naomi moved again, timed with the gunman's shift in attention. When his gaze moved toward Mercer, she adjusted another bed. When his focus dropped to the far corridor, she repositioned a second stand, aligning it with the structural column. Every action placed during a blind spot. Every movement minimal, but cumulative. The room reshaped around her. Not into safety, into control. The gunman noticed. Not immediately, but gradually. The lines he had mapped were no longer the same. The space had shifted. "Stop moving things," he said. His voice remained calm, but sharper. Naomi didn't stop. She adjusted the blanket over Maya's shoulder, unnecessary but precise. "Patients need stability," she said. Her tone didn't change. No challenge. No compliance. Just continuation. He watched her more closely now, tracking her timing, trying to catch the pattern. But she didn't repeat it. Every movement different. Every adjustment justified. Nothing obvious. Nothing direct. Ortega stepped closer again, this time within 2 steps of her position. Not leading. Following. His posture mirrored hers, low, controlled, ready. Mercer saw it clearly now. The structure. The coordination without words. He didn't interrupt. Didn't question. He stepped back instead, removing himself from the center he had tried to hold. The room no longer moved through him. It moved around her. Naomi felt the pressure building. Not just from the gunman. From the choice. Remain within the role or step beyond it. Every action she took increased visibility. Every adjustment narrowed the space between control and exposure. If she continued, he would see it. If she stopped, the room would fall back into his pattern. She chose to continue. The gunman shifted again. Closer. His attention narrowing. No longer scanning the room. Focusing on the source of disruption. "You're changing things," he said. Naomi didn't answer. Her hand moved, checking Maya's pulse, adjusting the line again. The monitor responded. Stable. For now. The gunman took another step. Closing distance. "You think I won't notice," he said. Naomi lifted her gaze. "Just enough." "I think you already have," she replied. No deflection. No denial. The room tightened. Ortega shifted slightly, ready to move, but holding position. The gunman's expression changed. Not anger. Not frustration. Calculation. He adjusted his stance. Weapon still low, but no longer passive. "You're making this harder," he said. Naomi didn't move. "Patients don't survive chaos," she said. The words landed. Not as resistance. As structure. He considered it. Then looked past her. Admire. The patient's position. The lines. The care. The stability Naomi had maintained. His gaze returned. Different now. Not assessing. Deciding. He stepped closer. Within reach of the bed. The distance collapsed. Ortega moved, but stopped. Waiting. Because Naomi hadn't moved. Because she hadn't signaled. The gunman's hand lifted slightly. Not the weapon. His free hand. He reached for the edge of the bed. Testing. Not grabbing yet. Just enough to claim proximity. Leverage. Naomi saw it. Immediate. Clear. Maya had become the point. The shift was complete. No longer about the room. No longer about control of space. About control of outcome. You care about her, he said. Not a question. Naomi didn't respond. Her posture remained unchanged. But her focus sharpened. The lines had narrowed. The options reduced. If he took the patient, everything she had built would collapse. If she acted, everything she had hidden would surface. The moment held. Balanced. Fragile. The gunman's hand tightened slightly on the bed rail. Not pulling. Not yet. But claiming it. And Naomi understood the next move would decide everything. The moment did not break. It shifted. The gunman's hand rested on the edge of Maya's bed, light but deliberate. Not pulling. Not forcing. Claiming position. Testing control. Naomi didn't move immediately. Her eyes tracked the angle of his arm, the distance between his stance and the patient, the placement of his weight. Too close to react blindly. Too exposed to delay. Her voice came, calm, even. Don't move her. Not loud, but precise. The room responded. Not because of authority, because of certainty. The gunman's gaze held on her. Why? He asked. Naomi's eyes shifted briefly to Maya's chest, tracking the breathing pattern, the instability still present beneath the surface. Her condition won't hold if you change position, she said. No emotion. No threat. Just fact. He studied her, then glanced down at the patient. Measuring. Calculating. The room remained still. Ortega didn't move. Mercer didn't speak. Everyone waited. Naomi stepped closer. Not into him. Into the space between. Reducing the distance. Not challenging. Rebalancing. Her hand moved to the fall line, adjusting flow by a fraction. The monitor responded. Stable. Holding. Step back half a pace, she said. Directed at him. Not asked. Not demanded. Placed. The gunman didn't move immediately. But he didn't resist either. He watched her. Then shifted. Half a step. Exactly as instructed. The change was small, but it restored the angle. Reduced leverage. Reclaimed space. Naomi didn't acknowledge it. She continued. Keep your hand where it is, she said. Don't apply pressure. Again, controlled. Measured. The gunman's hand remained on the rail, but his grip loosened. Slightly. Enough. Behind her, Ortega exhaled quietly. Not relief. Recognition. This was no longer reactive movement. This was command. Without rank. Without title. Just structure. Naomi's attention moved outward. Quick. Precise. Lower that bed, she said. A nurse responded instantly. No hesitation. The bed dropped by inches, reducing exposure, improving cover. Move the cart 2 steps left. Another staff member complied. The line of sight shifted. Blocked. Controlled. Every instruction small. Every change significant. The room began to move around her. Not in panic. In alignment. Mercer watched. Silent now. His position no longer central. No longer needed. He saw the pattern. The precision. The absence of wasted motion. And he stepped back. Fully. Yielding without being told. Naomi's sleeve shifted as she reached across the bed, just slightly. The fabric pulled back. The marks beneath her skin visible for a fraction of a second. Linear. Faded. Intentional. The gunman saw them. His gaze held there. Then lifted. Something in his expression changed. Not surprise. Confirmation. "You've been in worse places than this," he said. Naomi didn't respond. Her hand adjusted the patient's position again, correcting the angle of the shoulder, maintaining airflow. The monitor held steady. She didn't acknowledge the statement. Didn't deny it. Her silence answered enough. The staff had seen it too. Not the scars. The behavior. The control. The way the room had shifted without resistance. Understanding spread. Quiet. Immediate. Naomi's voice came again. "Ortega, hold that position." He nodded once. "No question. No delay. Keep the corridor clear." He moved, blocking the angle, securing the boundary. Naomi turned slightly. Her focus returned to the gunman. He hadn't moved. But his stance had changed. Less dominant. More aware. "You're not what they think you are," he said. Naomi met his gaze fully now. For the first time. Not challenging. Not defensive. Just present. "It doesn't matter," she said. Her voice remained even. "Right now, this patient does." The word settled into the space. Not as deflection. As priority. The gunman considered it. Then looked at the room. The alignment. The staff following her without instruction. The order without command. He understood. The control had shifted. Not taken. Given. Because it worked. Naomi turned slightly back to the bed. Her hands continued their work, final adjustments, confirming stability, maintaining the narrow balance she had built. Her voice remained calm. But now it carried. "Stay where you are," she said. To the room. To him. To everyone. No one moved. Not because they were afraid. Because they trusted the structure she had created. Mercer lowered his gaze. Not in defeat. In acceptance. He stepped further back, removing himself completely. Naomi didn't acknowledge it. Didn't need to. She had already accepted the role. Not by claiming it, by acting within it. The responsibility settled without weight. Because she had already been carrying it. The room held. Not frozen. Not chaotic. Controlled. Because she had made it so. And for the first time since the first shot, the outcome no longer depended on the man with the weapon. It depended on her. The room held in a fragile balance. Not safe. Not stable. But contained. Naomi stood beside Maya's bed, one hand resting lightly on the rail, the other near the fall line. Her posture remained calm, unchanged. But her attention had shifted. Not to the patient. To the sequence. The gunman's position. Ortega's angle. The staff behind partial cover. The narrowed corridor. Everything had reduced to geometry. Distance. Timing. Outcome. She didn't rush it. She waited. watching the gunman's breathing, steady, controlled, but no longer dominant. His stance had adjusted slightly since stepping back. His weight was no longer centered. He had given space. That space could be used. Naomi's eyes moved once, briefly, to Ortega. Not obvious. Just enough. A signal. Wait. Ortega held. No movement. No anticipation. Stillness. Naomi's hand adjusted Maya's oxygen line again. Small correction. "Stay with me," she said quietly. The patient's breathing responded. Holding. Naomi continued. "On my count," she said. Not to the room. Not loudly. Just enough. Ortega heard it. The nearest staff member heard it. The others felt it. No one asked for clarification. The plan was not spoken. It didn't need to be. Naomi shifted her weight. One step to the side. Opening a line. The gunman's eyes followed. Tracking. His attention narrowed again. Focused on her. Exactly where she wanted it. "You're still trying to control this," he said. Naomi didn't respond. Her eyes remained steady. Measuring. 3 seconds. His gaze locked. 2 seconds. His stance adjusted, just slightly, compensating for her movement. 1. Now. Her hand moved. Not toward him. Toward the bed. She pushed it half an inch. Just enough. The will caught the edge of the tile. A sharp, controlled sound. The gunman reacted. Instinct. His attention broke just for a fraction. He glanced down. That was enough. Ortega moved. Fast. Direct. Closing the distance from the side angle Naomi had created. The gunman reacted instantly, turning, weapon rising. But the space had changed. His angle was wrong. Naomi stepped in. Not to engage. To disrupt. Her hand struck his wrist, not forceful, but precise, redirecting the line of the weapon. The shot fired. Wide. Into the ceiling. Sound contained. Direction lost. Ortega reached him, gripping the arm, forcing it downward, controlling the joint. The gunman resisted. Not wildly. Trained. He shifted weight, trying to regain balance. Naomi moved again. Not striking. Adjusting. Her foot placed behind his, removing the support he needed. His balance broke. Half a second. Enough. Ortega took him down. Controlled. Hard. The weapon hit the floor. Sliding out of reach. Another soldier moved in, securing the arm, locking it in place. The struggle ended quickly. Not dramatic. Not extended. Contained. The room went still. Again. But different this time. The threat had collapsed. Not removed by force alone. By structure. By timing. By precision. Naomi stepped back immediately. Not claiming the center. Returning to the edge. Her attention snapped back to Maya. The patient's breathing had spiked again. Shock, sound, movement. Naomi adjusted the line. Corrected the angle. Stabilized the flow. The monitor responded. Slow. Then steady. "Hold her here," she said. A nurse moved into position instantly. Following. Not questioning. Naomi checked the secondary line, confirming no disruption from the movement. All intact. All holding. Behind her, Ortega secured the final restraint. "Clear," he said. His voice was low. Controlled. No urgency. Because it was done. Security entered seconds later, late, but no longer needed. They moved to take custody. No resistance. The gunman remained still. Controlled. Neutralized. Mercer stood where he had stepped back earlier. Watching. Silent. No attempt to reclaim authority. No attempt to speak. The room had already decided. Naomi didn't look at him. She didn't look at anyone. Her focus remained on the patient. The work. The reason everything had been done. Maya's breathing steadied. Consistent now. Not perfect, but stable. Naomi made one final adjustment, locking the position, ensuring the line would hold without her hands. Then she stepped back. Half a pace. Just enough to observe. Confirm. The monitor held. The room exhaled. Quiet. Collective. Not relief, but release. The pressure had passed. The structure remained. Ortega stood, looking at Naomi. Not speaking. Just understanding. She gave no acknowledgement. No signal. No recognition. She simply turned slightly, returning to the edge of the room, where she had started, as if nothing had changed. But everything had. Because the crisis had ended, not through force, not through authority, through control. And she had held it until the final movement. Morning arrived without urgency. The night did not end with noise. It faded. The storm outside had passed some time before dawn. The cold remained, but the pressure had lifted. Pale winter light filtered through the high windows, soft and distant, washing over the ER without changing its shape. Inside, the room had already been reset. The broken ceiling panel had been cleared. Equipment returned to position. Blood cleaned. Surfaces restored. Only small details remained. A scuff along the floor tile. A dent in the bed frame. A silence where tension had been. Police moved through the corridor in controlled patterns, quiet voices, measured steps. Statements taken. Positions recorded. No raised tones. No spectacle. Administration followed. Clipboards. Questions. Procedures. They filled the space left behind by urgency. But they did not touch what had actually happened. Inside the ER, the day shift had begun. New staff moved in, fresh, unaware, stepping into a system that appeared intact. They asked routine questions. Checked charts. Reviewed notes. No one described the night in full. No one needed to. Naomi stood at the supply cart. Her hands moved through familiar motions, stacking linens, replacing a half-empty box of gloves, aligning trays without looking down. Her pace had not changed. Her posture had not changed. Nothing about her suggested she had been at the center of anything. Behind her, a patient call light blinked. She moved before it sounded. Room 4. The patient needed water. She adjusted the cup. Checked the line. Repositioned the pillow. Small corrections. Unseen. She stepped back. Left the room as quietly as she had entered. At the nurse's station, Dr. Mercer stood reviewing a chart. He didn't speak as she approached. Didn't look up immediately. But he was aware. She placed a file beside him, correcting its position without comment. He glanced at it. Then at her. For a moment, the noise of the room seemed to drop away. Not silence. Focus. He studied her, not the role, not the uniform. The pattern. The precision. The absence of hesitation he had missed before. You saw it early, he said. His voice was low. Not public. Not for the room. Naomi didn't respond. She adjusted the edge of the chart, small movement, aligning it with the others. I didn't, Mercer continued. The admission sat between them. No defense. No justification. Just fact. Naomi's gaze remained on the task. The patient is stable, she said. Not redirecting. Not dismissing. Just placing the next priority. Mercer nodded once. He understood. There was nothing else to say. No acknowledgement would change what had already been done. He stepped back slightly, not yielding authority, recognizing its limits. Naomi moved on. The corridor carried its usual rhythm now, stretchers moving, voices overlapping, monitors sounding in controlled intervals. Routine had returned. At the far end, Ortega stood near the security desk. He watched her as she passed. Not openly, but with recognition. He gave a small nod. Barely visible. Naomi didn't return it. She continued walking. The system did not change around her. Staff still moved past without pause. Conversations continued without interruption. No one announced what had happened. No one asked. But something had shifted. Subtle. Permanent. A nurse reached for a medication tray, hesitating slightly, checking the label twice before proceeding. Another adjusted a patient's position with more care than before. Small changes. Not taught. Observed. Learned. Naomi returned to the central station. An intern searched through a stack of files, frustration building. It was here, he said. Naomi placed it beside him. He picked it up mid-sentence, never looking at her. She stepped away, back to the edge, where she had always been. Near the far room, a patient monitor dipped slightly. She adjusted the line, corrected the angle. The numbers stabilized. No one noticed. No one needed to. The hospital continued, as if nothing had happened. As if the night had been contained within itself. Naomi moved through it without leaving a mark. No recognition. No shift in role. No change in how she was addressed. Only the quiet continuation of work. The same as before, but not the same. Because the system had seen something it hadn't recognized. And even without naming it, it had adapted. Naomi returned to the supply cart. Adjusted a stack of linens, replaced a missing item before it was requested. Her movements remained steady, unremarkable, invisible, exactly where she chose to be, and where she remained, as the hospital moved forward, unaware of how close it had come, and who had held it together without ever stepping into the light.